The man's heart was failing, blood pressure dropping, cardiac tamponade, minutes until death. Dr. Marcus Chen froze, staring at the monitor. He'd never done this procedure, not in real life. Dr. Chen, the voice behind him wasn't asking, it was commanding. The quiet nurse he'd called, too soft, for 6 months stepped forward, already gloved. With your permission, I'll take this one. Everyone in the ER stopped, because Emma Walsh wasn't moving like a nurse anymore. She was moving like someone who'd done this, in a war zone. Welcome to Echo Tales, where ordinary people reveal extraordinary strength. Before we dive into today's story, if you enjoy powerful tales of courage, justice, and hidden talents, make sure to hit that subscribe button and turn on notifications. We share real-life inspired stories every single day. And here's a question for you. Have you ever been underestimated? Have you ever watched someone prove their doubters wrong? Drop a comment below and let us know where you're watching from today. We love hearing from viewers around the world. Whether you're watching from a bustling city like New York, or a quiet town in the Midwest, perhaps you're a healthcare worker yourself, or maybe you know someone who chose a quieter life after trauma. Today's story is about Emma Walsh, a nurse who everyone thought was too emotional, too slow, too soft for emergency medicine. What they didn't know was that she had kept 23 soldiers alive under mortar fire in Afghanistan. And when 31 trauma patients flooded through the hospital doors, the doctor who mocked her was about to learn what real emergency medicine looked like. Emma Walsh had learned to be invisible, and she was exceptional at it. At 34, she worked the night shift at Metro General Hospital in Chicago, a sprawling trauma center that served the city's south side. Her personnel file listed her nursing degree from a state college, 5 years of her experience, and consistently positive patient reviews. What it didn't mention was her 8-year Army career, or the 3 tours in Afghanistan, where she'd served as a combat medic with the 75th Ranger Regiment. The decision to leave military medicine hadn't been easy. Emma had loved the precision, the purpose, the knowledge that her skills made the difference between life and death in the most extreme circumstances. But after the Helmand Province incident, after watching 2 Rangers die in her arms before the helicopter could arrive, she'd felt something break inside. Psychologists called it moral injury. The moment when you follow all the rules correctly, but people still die. Emma just knew she needed something calmer in civilian life, something with less life and death pressure. When she'd arrived at Metro General, she'd deliberately kept her military background minimal. During the interview, when asked, "Do you have any trauma experience?" she'd said, "Some." Technically not a lie, just incomplete. The first 2 years were perfect. She worked quietly, compassionate but professional, took pleasure in watching patients heal. The night shift suited her perfectly, fewer administrators, less politics, just the work. Then Dr. Marcus Chen was appointed as Assistant Chief of Emergency Services, and everything changed. Marcus Chen was 38, a Northwestern University Medical School graduate, who never hesitated to let everyone know it. He'd come to the emergency department 5 years ago, risen quickly, and built his reputation on clinical excellence. His diagnoses were fast, his procedures were confident, and his management style was authoritarian. Marcus' philosophy of emergency medicine was simple: speed was everything. Nurses who spent too much time with patients were inefficient. Talking too much with families was a waste of time. Emotional connection detracted from professionalism. When the hospital's efficiency increased by 12%, administration validated his methods. Nobody measured that staff morale had dropped. His first notice of Emma came on a late-night shift, when he saw her holding an elderly woman's hand. The woman's husband had just died, and she was crying quietly while Emma sat beside her. Marcus had approached and said coldly, "Walsh, we need you in room 4." Emma had stayed 1 more minute before releasing the woman's hand. The next day at the team meeting, Marcus used her as an example of what not to do. "Empathy is a good thing," he'd said, looking at everyone, "but our time and resources are limited. We need to remember that nurses are here to provide medical care, not emotional support." Emma had said nothing. She'd learned something at Ranger School. The quietest student was usually the one who absorbed the most. The following months became a slow erosion for Emma. Marcus never attacked her directly, he was too smart for that. Instead, he offered constant criticisms and suggestions. When she spent 5 minutes explaining something to a patient's family, "Walsh, we don't need that much detail. Keep it simple and move on." When she was extra gentle with a pediatric case, "The way you talk to children undermines professionalism. Be kind but efficient." When she questioned a trauma protocol, "Walsh, we follow procedures. We don't improvise." The other nurses noticed. Sarah Kim, a senior nurse with 10 years of experience, approached Emma one evening. "Ignore Marcus," she'd said quietly. "He's like this with everyone. It's not really personal, he's just a control freak. But it felt personal, especially when Marcus pushed her to the background during trauma cases. He ignored Emma's triage assessments, trusting less experienced nurses instead. Emma's suggested treatment approaches were frequently dismissed. The worst moment had been 3 months ago. A high-risk trauma patient had arrived, motorcycle accident, probable internal bleeding. Emma immediately recommended a CT scan. Marcus wanted observation instead. 2 hours later, the patient suddenly deteriorated. The CT scan showed a ruptured spleen. The patient survived, but barely. Emma went home that night and cried for the first time in years. It reminded her of Hellmand, knowing you did everything right but still feeling inadequate. At 2:39 p.m., a tour bus carrying 43 passengers lost control on Interstate 94. They would later learn the driver had suffered a heart attack. The bus had hit the center barrier, crushed 4 cars, and rolled onto its side. First responders were there within 10 minutes, but the scene was devastating. Metro General was the primary field hospital for the trauma incident. When the announcement came, Marcus was at the control center, on her duty. Emma was in the supply room, thinking tomorrow would be another boring shift. Mass casualty incident. All available personnel to her. Emma's training kicked in. Without anyone seeing, she ran the mental checklist she'd used in the field hospital. Triage categories: red, immediate; yellow, urgent; green, minor; black, fatal. Resource allocation, operating room capacity, blood bank stock, personnel availability. Communication protocol, first response teams. Activation procedures, family notification system. When she reached the Marcus was already taking command. He was drawing chaotic diagrams on the whiteboard, giving orders. But Emma saw immediately, there was no structure. He was putting the first arriving patients wherever he could. No triage categories, no prioritization. It gave her a familiar feeling. Good people, with good intentions, making wrong decisions, that could lead to deaths. The first ambulance arrived at 2:55 p.m. Two paramedics carried a young man on a backboard, with a cervical collar and head immobilizer. 23-year-old male, the paramedic shouted. Ejected from bus, suspected neck injury, vitals stable. Marcus immediately directed them to Trauma Room 1, the best equipped room. Emma sighed internally. This was a green case, stable vitals, ejection but conscious. Good but not urgent. They needed to save Trauma 1 for red cases. The second ambulance came 30 seconds later. A middle-aged woman, open chest bleeding, decompression needles for pneumothorax, oxygen saturation dropping. Get her to Trauma 2, Marcus said quickly. Emma stepped forward. Dr. Chen, maybe we should reconsider priorities. Not now, Walsh. Don't distract me. Marcus focused on the next ambulance. The next 15 minutes were a nightmare. Patients came, some requiring emergency surgery, some needing stabilization, some just needing cleanup. Marcus tried to direct them, but there was no system. Casualties ended up in random rooms. Staff forgot which room had which patient. Communication collapsed. At 3:12 p.m., patient 21 arrived. A young woman, 19, unconscious, weak pulse, bruising on her abdomen, probable internal bleeding. Trauma 3, Marcus said. But Trauma 3 was full of green cases. When she didn't get adequate care, her blood pressure could enter a death spiral. Emma watched, pulse racing, consciousness blurring. It reminded her of Hellmand. You have the knowledge but nobody's listening to you. Then another patient arrived. 40-year-old man, chest hit steering wheel, pneumothorax, flail chest, potential cardiac tamponade, life-threatening, could be fatal within minutes. Marcus froze. In front of him was a case he knew from literature but had never actually seen in real life. Dr. Chen. Emma's voice had changed. She was no longer the nurse asking for favors. This was someone used to giving orders. Marcus looked at her, a mixture of shock and anger. Walsh, I'm busy right now. This patient has cardiac tamponade. We have minutes. We need emergency pericardiocensis. Now. Anyone 20 feet away watching Marcus couldn't see what Emma Walsh was becoming, but Marcus was beginning to see. Okay, I'll do it. With your permission, I can perform the procedure. Emma was already getting fresh gloves, mask, and goggles. Her movements had military precision. Marcus' head nodded, bewildered. Emma moved to the patient. What I need: ultrasound machine, 18-gauge needle, antiseptic, local anesthesia. Sarah, monitor vitals. David, watch oxygen saturation. Marcus, stand behind me, I'll teach you. Everyone moved. There was something unbeatable in Emma's voice. Emma watched the monitor, located the pericardial fluid, advanced the needle, precise but determined. Marcus stood behind her, watching in amazement as this nurse performed an emergency procedure with senior surgical skill. The needle reached the pericardium. Emma slowly withdrew, aspirating the bloody fluid. The patient's heart rate corrected. Blood pressure stabilized. The entire procedure took 4 minutes. Emma stepped back, removed her gloves. "We need cardiothoracic surgery. Is Theo ready?" Sarah nodded, still in shock. "Yes, ready. Approved transfer immediately." Emma raised her voice, looking at the rest of the room. "Everyone, attention. Triage reorganization. Red tags to trauma 1 and 2. Yellow tags to trauma 3 and 4. Greens to waiting area. Monitored but not urgent. Blacks, there's nothing we can do. Keep them comfortable." Staff looked at each other hesitantly. Marcus was still in shock. Emma turned to Marcus, her voice softer. "Dr. Chen, I need your permission." Marcus slowly nodded. "Continue." The next 2 hours passed in a blur. Emma took command, calmly and methodically. She prioritized trauma cases, allocated resources, directed personnel. Every decision was clear, decisive, and beatable. Nurses followed commands. Doctors concentrated on procedures. The system worked. At 5:23 p.m., the last patient was stabilized. Of 31 patients, 29 were alive. 2 people had died on scene when the bus first crashed. When hospital director Dr. Patricia Morgan arrived, the ER looked like a controlled operation rather than organized chaos. "Status report," she said, looking at Marcus. Emma stepped forward. "Dr. Morgan, we received 31 patients, 2 deaths on arrival, 29 stabilized, 12 sent to surgery, 17 admitted for observation, 2 discharged." Morgan looked at Emma. "I'm sorry, you are Emma Walsh, registered nurse, night shift." Morgan raised her eyebrows, then looked at Marcus. Marcus shrugged helplessly. Sarah Kim stepped forward. "Dr. Morgan, Emma managed the mass casualty triage. Without her the losses would have been much greater." Morgan nodded slowly. "I see." She turned to Emma. "Do you have mass casualty training in your background?" Emma hesitated. Then, "Yes, Mom. Army, combat medic. 3 tours Afghanistan." Silence. Everyone was staring at her. Marcus' mouth hung open. Morgan smiled. "Why didn't I know this in your personnel file? I thought I'd left it behind, Mom." The next day, Marcus called Emma to a private meeting. In his office, door closed, 2 coffees on the table. "I should have known," Marcus said quietly. "I judged you, didn't respect your skills. I apologize." Emma nodded. "Accepted. Morgan wants to transfer you to day shift as triage coordinator. You'll rewrite mass casualty protocols, train personnel, prepare for future incidents." Emma sipped her coffee. "I'll accept conditionally." Marcus looked surprised. "Conditions? This isn't solo work. It's teamwork. You're still Assistant Chief of Emergency Services, but you need to listen, not just to doctors, but to nurses too. We have experience too." Marcus nodded. "Understood." "Agreed." Metro General's mass casualty training program attracted national attention. Emma's designed START triage system was adapted by 12 city hospitals. She worked day shift, better managing her nighttime fears. Marcus was still Assistant Chief of Emergency Services, but his approach had changed. He now asked for input from nurses at team meetings. He integrated Emma's methods into his own practice. Efficiency dropped slightly, but patient satisfaction increased by 31%. One evening, Emma was mentoring a new nurse, 24-year-old Rachel Torres, fresh graduate but talented. Emma saw Rachel holding a patient's hand. "Don't worry," Emma said gently. "Empathy isn't weakness, it's strength. You just need to know when to use it appropriately." Rachel smiled. "Did someone old tell you that?" Emma touched her father's dog tags, carried in her pocket. "Someone who taught me showed me. The quietest person in the room is usually the most experienced. Never judge by appearance." Outside, the Chicago sun was setting, city lights coming on. Emma Walsh was no longer invisible, but she was still quiet, still compassionate, still the same nurse. Except now nobody called her too soft. Because compassion wasn't weakness. It was the power that transformed chaos into healing. If you enjoyed this story, don't forget to subscribe and become part of the Echo Tales community, where we share powerful stories every day. Where are you watching from? Drop a comment below. We love hearing from our amazing viewers around the world.